Hi, my name is Ashley Lemaitre, and I am with Austin Public Health. Thanks for joining me to learn more about vaping in teens. I will be covering what electronic vaping devices are, the risks of using them, the impact of tobacco and e-cigarettes in our community in Austin, Travis County, approved devices for quitting tobacco, some of the laws and regulations around them, and what parents, caregivers, and schools can do to protect their children. So first, I will cover what electronic vaping devices are. Electronic vaping devices, as you saw in the video at the beginning, can come in different shapes and sizes. Here you'll see a few examples of sneaky looking vaping devices that are small and or look like other common items, making them easy to miss if you come across them. E-cigarettes produce an aerosol by heating a liquid that usually contains nicotine, flavorings, and other chemicals that are inhaled. These devices can also be used to inhale other drugs, such as marijuana. Other names you might hear them by include e-cigs, e-hookahs, mods, vape pens, vapes, tank systems, and electronic nicotine delivery systems. While you might hear the term smoking when talking about traditional combustible cigarettes, you will more often hear the term vaping to describe the act of using an e-cigarette. Nicotine salts, also known as nic salts, are found in many newer types of e-cigarettes and allow for higher levels of nicotine to be inhaled more easily and with less irritation to the throat compared to traditional free-base nicotine. This allows for more efficient nicotine delivery than previous generations of e-cigarettes, which has the potential to help current tobacco users to quit, but could also increase the possibility of product initiation and dependence. Another term you might hear is tobacco-free. This means that either one, the product is made in a lab, so it's synthetic or non-tobacco nicotine, or two, the product contains no tobacco leaf. All of these products still contain nicotine though, and regardless of the source, it's still dangerous to young people. Additionally, the tobacco-free claim has been shown to give reduced harm perception and increase the likelihood for someone to try a product. So how do they work? Generally, they consist of a battery, which powers the device, an atomizer, which is how it's heated to create an aerosol, the cartridge, which stores the e-liquid, and the mouthpiece. There are several different classifications of vaping devices. First, we have the closed pod systems, which use disposable pods that contain an e-liquid. The body can be recharged and you replace the pods when they're empty. An open or refillable system requires that the user add vape juice, so none of the parts are disposed of. These types of systems can also be modified to do tricks. Disposables are devices that are entirely disposable, so no parts can be reused after it runs out. They can be used for about 200 to 400 puffs before they have to be replaced. Electronic cigarettes may produce or maintain nicotine dependence, and sometimes the marketing of the ingredients in these products is inaccurate. We're still learning what the long-term effects are, but we do know that the aerosol produced is not harmless water vapor. Electronic cigarettes contain volatile organic compounds, ultrafine particles, cancer-causing agents, heavy metals, and many contain nicotine and flavorings such as diazosol, which has been linked to serious lung disease. One thing also to note is that some flavorings that have been tested and deemed food safe are considered safe to eat. And this doesn't necessarily mean that they're safe to be inhaled through the lungs, because the gut can process more substances than the lungs. And when combined with other ingredients and then heated, they can create new compounds that can be harmful. Some examples of flavors include Skittles, gummy bear, cotton candy, banana split, fruity Hawaii, which sounds a bit like Hawaiian Punch to me, sugar cookie, peanut butter cup, peanut butter and jelly, strawberry roll-up, and many variety of lemonade flavors. Many things that would interest and appeal to kids and teens. Research has shown that both fruity and cooling flavors can help suppress the harshness of nicotine, which can help promote initiation by teens. Some vape liquids are marketed as containing 0% nicotine, but they've been found to contain nicotine. Disposable vaping devices are the most common and most popular among young people. Their sales skyrocketed in popularity after these products were exempted from federal restrictions regarding flavored e-cigarettes. More than half of youth and young adult e-cigarette users surveyed used disposable e-cigarettes over other types of e-cigarettes. More than 90% of e-cigarettes sold contain the highest levels of nicotine. We saw an increase in use of disposable products of 1,000% among high school e-cigarette users between 2019 and 2020. E-cigarettes with high nicotine levels have either decreased or not changed, while those with lower levels are more expensive than before. Now, I'm going to go into the risks associated with vaping. You may have heard people saying that nicotine can help relieve stress. That's actually a myth. Nicotine can actually increase feelings of anxiety and depression and increase stress. This is your body going through withdrawal. When you use nicotine products again, it's your body getting that temporary relief. The part of the brain that's responsible for decision making and impulse control isn't fully developed in teens. This puts them at risk for long-term, long-lasting effects of exposing their brain to nicotine. This includes nicotine addiction, mood disorders, and permanently lowering their impulse control. Nicotine also changes the ways the synapses are formed, which can harm the parts of the brain that control attention and learning. The brain's actually still growing until around age 25. Every time a new memory is created or a new skill is learned, stronger connections or synapses are built between brain cells. Young people's brains build synapses faster than adult brains. And because addiction is a form of learning, teens can get addicted more easily than adults. Nicotine can also prime the teenage brain for addiction to other drugs. There is also a strong link between e-cigarette use and the use of other tobacco products. There's also some evidence to show a linkage to alcohol use and other substance use. Additionally, some e-cigarette products can be used to deliver other drugs. Studies show that non-smoking youth who use e-cigarettes are more likely to try conventional cigarettes than non-smoking youth who don't use e-cigarettes. Among high school students and young adults who use 2 or more tobacco products, the majority use both e-cigarettes and burn tobacco products. Some of these products have been known to have defective batteries, which have caused serious injuries and even death. There's also risk of acute nicotine exposure, which can be fatal. Children and adults have been poisoned by swallowing, breathing in too much vapor, or spilling it on their skin. Nationally, there were 687 cases just in the month of January of this year. You might remember hearing about E-Valley, which is e-cigarette or vaping product use associated lung injury. Some of the symptoms include coughing, shortness of breath, chest pain, nausea, vomiting, diarrhea, fatigue, fever, and abdominal pain. There were thousands of patients hospitalized across the U.S., with 15% of patients being under the age of 18. There was a sharp increase in cases in August 2019, peaking in September. And most cases were found to be linked to e-cigarette or vaping products containing THC, a compound found in cannabis. THC-containing products continue to be the most commonly reported e-cigarette or vaping products used by E-Valley patients. And it appears that vitamin E acetate is associated with E-Valley. However, many substances and product sources are being investigated, and there might be more than one cause. Bronchiolitis obliterans, or popcorn lung, is a condition that results in damaging the lungs' small airways. This condition is caused by diatisol, which is commonly used to flavor e-liquid. It first got its nickname because popcorn factory workers became ill with the debilitating lung disease, which was later tied to the vapors from popcorn flavoring added to popcorn. Other concerns include vaping-related lipioid pneumonia and a collapsed lung. Could it cause cancer? We don't know yet. We know that things in these products are known to cause cancer, but they haven't been around long enough for us to know the relationship between vaping and cancer. Looking at the impacts of tobacco and e-cigarettes. Tobacco continues to be the #1 preventable cause of death in Austin and Travis County and kills about 10 people each week. About 1 in every 100 middle school students and 2 in every high school students are currently smoking cigarettes. In Travis County, 26% of adults have tried vaping. 6.6 are current e-cigarette users. E-cigarettes have been the most commonly used tobacco product among youth since 2014. Among U.S. middle and high school students, we have seen the rates of those vaping nicotine double from 2017 to 2019. In 2020, that rate has held steady. The National Youth Tobacco Survey found that as of 2022, more than 1 in 4 middle and high school students is using e-cigarettes daily, most commonly disposables. The most common reported brand is Puff Bar. Almost 85% are using flavored e-cigarettes. Looking more at the National Youth Tobacco Survey, when asked how much harm they think e-cigarettes cause, most 6th through 12th graders didn't view them as causing a lot of harm. And about 32% responded that their friends think e-cigarettes are completely or mostly acceptable. You may have wondered whether e-cigarettes can help you quit. E-cigarettes are not currently approved by the FDA as a quit device. The evidence is currently not sufficient to do so. One important thing to recognize is that some of the largest tobacco companies own or partially own electronic cigarette companies. It's very interesting. There are many approved medications that help people quit tobacco. These have been studied and have been shown successful. They include gums, lozenges, patches, nasal spray, an inhaler, and several pharmacotherapy options. Now we'll get into some of the laws and regulations around tobacco and vaping. Looking first at federal laws, in 2009, the Family Smoking Prevention and Tobacco Control Act law went into effect, which gives regulation of cigarettes, smokeless, and roll your own tobacco to the FDA. In 2016, this was updated to include all tobacco products, including electronic cigarettes and vape pens. At the end of 2019, the Tobacco 21 law was signed, which raised the federal minimum age sale of all tobacco products to 21. In 2020, FDA limited flavors in e-cigarettes. There was an exemption on menthol, and disposables and refillable cartridges were excluded from the restrictions. So what's included or not? The policy still allows all menthol flavors, including enclosed pods, and it also allows any flavored liquid in open systems and disposables. In terms of state laws, Texas has a few things in place, including restricting use in schools and child care centers. There are also laws around retail access, including requiring liquid nicotine to be in a child-resistant container, prohibiting the sale to minors, restricting the self-service and vending sales of e-cigarettes to 21-plus facilities, and requiring retailers and delivery sales to register with the state before selling e-cigarettes. Locally, Austin has the Smoking in Public Places Ordinance, also known as SIPO, which prohibits smoking and electronic cigarettes within 15 feet in most public places and parks. We also have laws that align with federal and state laws around sale and access to tobacco products, including electronic cigarettes. Now that you know more about electronic cigarettes and vaping, you may be wondering what you can do. As you prepare to talk to your kids, make sure you know the facts. Be patient and be ready to listen. It's also important to do some self-reflection and set a positive example. If you yourself use tobacco, this is a good time to try to quit. One of the top reasons youth cited for vaping was use by a family member or friend. Also, if you need support, ask for help. As you try to figure out how to start the conversation, work it into the conversation. Educate them. Don't just list statistics. Explain why the tobacco companies want kids to smoke. Explain that getting teens started early increases the chance that they will become long-term users. And tobacco companies need that money. Be clear that you don't approve of them using these products and talk about the consequences. Be ready and prepared to answer questions and commit to keeping the conversation going over time. There are several great free cessation resources available for teens. There's a text message-based program called This Is Quitting and Smoke Free Teen, which allows teens to set up a digital quit plan. This Is Quitting also has a text component for parents of young people that vape that need support. I want to quickly mention there are also several great programs to help adults stop using tobacco that are also free. There's the Smoke Free Text program, which is a text message-based quit program. The Texas Quit Line has phone or web counseling, and some people qualify for the nicotine replacement therapy. Become an X is another program which offers a digital quit plan and community for support. Catch My Breath and Aspire are both evidence-based prevention programs that can be implemented at the school level. If you have a kid interested in learning more about tobacco prevention, Say What is a great youth tobacco prevention coalition. They offer free summits for 6th through 12th graders, mini grants for projects, and other great resources for young people looking to do more. There are more great resources you can check out for more advice and how to talk to your kids about vaping, and these are just a few of them. Please feel free to reach out to me if you have any additional questions. Thank you.